Thanks, everyone, and thanks for joining. Thanks for your time. Today, we're going to talk about the liver and all of these sessions that we do, especially which are in the category of preventive wellness. We focus mainly on, what you can do to prevent the onset of disease. And if we do get the disease, there's a possibility that if we've looked after our organs, we have a chance to recover way faster than someone who hasn't. So today, we're going to talk about the liver. Very small organ in the human body, but extremely important. Everything you eat, everything you drink, the air that you breathe, everything goes through the liver. It's that important. Without your liver, you can't live, like your heart. So it's got a job of, a lot of people like living in certain parts of the country. They eat well, they exercise, but yet they have so much of toxicity in their body because their livers become overburdened with the pollution levels. So it's everything. It's not just food, like we always say. Today, we're going to understand a little bit more about the liver and what we can do to build a healthy liver and keep it that way. In case you do have a liver problem, of course, we will not be talking about resolutions on this particular call, but we have several videos which are already done for people with non-alcoholic fatty livers, liver cirrhosis, liver cancers, which you can access at some point on our YouTube channel. So the liver is a small organ, one of the only organs that can actually regenerate, which is you can cut a small piece of the liver and it has the possibility of regrowing again. It's a very, very dynamic organ, and it can withstand a certain amount of, damage. It can regrow. But once it passes that stage, if you've heard of a cirrhotic liver or liver scarring, that's when the liver is being pushed too much or abused too much, that to protect itself, it starts developing scars. And these scar tissues and the scarring, like in the cirrhotic liver, decreases liver function, and over time the organ moves into failure. So how do we prevent that from happening? What are the kind of liver tests that we do to make sure our liver is working the right way? Because like I said, prevention is always better than cure. We think everything is good, but today we're against pesticides in food, we're against pollution in air. We have many, many obstacles that the human body is trying to adapt to and trying to overcome. So there's no such thing as a liver detox. The liver itself is an organ that has the ability to detox, but sometimes by giving it the right food, right amount of blood circulation, the right amount of rest, we help the liver do its job better, which means process the toxins, process, all the bad stuff that gets into us before it reaches other organs and causes damage to us. The liver also has the function of storing glucose. So very, very important when you're working out, very important when you're not eating. We store glucose in the liver, like we also store certain vitamins and certain minerals. So sometimes people have deficiencies of certain vitamins and minerals when they have liver conditions. And if you don't make sure that you put those vitamins and minerals back into your system because it's not stored in your liver because your liver is damaged, then you start to have other problems which are caused because of the deficiency of vitamins and minerals. Harmful chemicals and toxins go through our liver. Okay, I'm not against alcohol. I'm against a person who abuses alcohol. When I say against, not in a bad way, but from a body aspect, it affects you. If you didn't have a liver, alcohol would kill you. It's as simple as that. It's because of your liver that it's able to process alcohol into a more stable form that doesn't cause harm to us, which is why the abuse of alcohol, drinking too much of alcohol at one time, after a while starts to damage the liver. The liver is a very resilient organ, like most organs in the human body, and it will do its best to adapt, to survive, and survive until you've pushed it too much. So here you have someone who's drinking alcohol, here you have the same person who's smoking, here you have someone who has an improper diet, lacking in vitamins and nutrients. You have the same person on heavy medication. That becomes so much of a burden for the liver that the liver slowly starts to get weaker and weaker. So one way of making our liver better is by reducing the burden from the liver by helping it by living a better lifestyle. Because there are certain things which are out of our control, like pollution. We can't really change the pollution in the place that we live. We can do breathing exercises. We can make sure that we are eating the right foods, the right vitamins and minerals that have a job of attaching onto toxins and removing it from our system. We can make sure that we're not constipated and keeping waste in our system for a longer period of time. So there are many things that we can do. The liver has the function of producing bile as well. With bile, we are able to break down fats. So liver also plays a role in fat burn. So a lot of people who come to us with weight loss, when they've reached plateaus and they can't lose weight, they've done fad diet after fad diet, we only just look at their liver, we rebalance their liver health. If their SGOT, their SGPT highs are, the levels are too high, the liver enzymes are causing more damage to the liver, we help to rejuvenate the liver, it starts working, and the person starts to lose weight. It's unbelievable how weight loss and fat loss is also connected with the liver. The liver plays a huge role in that. We have to be careful of things like hepatitis. We have hepatitis A, which is caused by contamination in food and water. We have hepatitis B, which is caused by sexual contact, multiple partners, blood, needles, exchange of injections. And we have hepatitis C again, which is caused by contact with blood between needles, transfusions, etc. It's so important that if you start to have the symptoms of that, your doctor may offer you vaccinations for hepatitis, depending on, what's gone wrong with you, or of course, after a diagnosis, if you've been having, for example, multiple partners, you've not been having safe sex, vice versa, you're showing symptoms of liver inflammation and damage, they may get you to do a hepatitis vaccination. It is extremely important for people to understand that hepatitis causes liver damage and sometimes irreversible liver damage. So we need to be mindful of that as well. There are other risk factors as well. Alcohol abuse being one of the biggest. You have to understand, yes, we know alcohol is a coping mechanism for all people. We also know people who like to binge drink alcohol because it makes them feel cooler, it makes them feel stronger, it makes them feel more important. These are signs of low self-esteem, but we need to understand. And I also know people in their 90s and 95, they have one peg a day and they're absolutely fine. So you need to understand that everything has to be done in balance. Okay, it's wrong to say that alcohol alone will cause liver disease, because we also know so many people who don't drink alcohol, and they also have non-alcoholic fatty livers and they have liver disease. The point is, don't abuse it if you are drinking alcohol. Understand that. And if you have a liver problem, all the more stop drinking alcohol. There are a lot of doctors who allow their patients to continue drinking alcohol. And you have to understand that your liver has to work harder to break down alcohol. So if you're already sick and you already have a liver problem, you want your liver to repair as quickly as possible to look after you. Adding more alcohol and more burden for it to break down is another big risk factor. Healthy weight. Your weight has every connection with your liver as well. Remember, every organ is working for every extra pound of fat that you carry. Okay, and your body can adapt and survive. So don't be scared that if I'm overweight, am I going to have a liver problem? No. But yes, prevention is better than cure, and we want to make sure that we maintain and work towards a healthy fat percentage in the body so that we don't have any complications with the liver. Okay, your screening. Screening is extremely important for liver. You don't want to wait until it's the end where your body's thrown up so many symptoms and then you get checked up and then the damage is already, done. So you can do simple liver tests, which I'll share at the end. Once a year, maybe, if you don't have a problem. Of course, if you're on certain medication like chemotherapy, radiation, and other heavy drugs, your doctor may ask you to do regular CBCs where you check your liver profile to see that the medication is not causing harm to your liver. So screening is extremely important for you. Other risk factors are diabetes. Again, we saw diabetes as a risk factor for heart disease. It is also a risk factor for your liver. So it's extremely important for us that if we have diabetes, we want to work with our doctors to control our blood sugar levels. At the same time, we want to work with controlling our lifestyle and building new lifestyle so we can actually look at reversing type 2 diabetes and your doctor slowly weaning off your medication because you have no requirement to be on medication anymore. Non-alcoholic fatty liver, millions of people in our country and across the world suffer from this. And they're like, Luke, but I don't even drink alcohol. Yep, it's also because of your diet. It's also because of environmental pollutants. So if your diet's wrong, you're putting on too much of weight, you're having too much of fructose, too much of refined sugars, too much of refined carbs, white flours, all of the bad stuff in your body. Like I said, everything goes through your liver. After a while, your liver starts to slow down. Your enzymes start to go up, causing inflammation and liver damage. So it's extremely important to understand that non-alcoholic fatty liver is purely because of your poor lifestyle, which is why there's no real medicine to treat a non-alcoholic fatty liver. Your doctor may put you on a couple of supplements and ask you to change your lifestyle and lose some weight. And that is extremely important to do. Medications. A lot of medications have the side effects where they can damage your liver. So your doctor would obviously keep you informed about that. And sometimes you can always ask your doctor if any new medication that you're on can harm your liver. So then at least while you have to take the medication, you can work with the side effects of your primary drug so as to negate or prevent the damage of your liver, which is absolutely possible. Self-medication over prescription of medications, very dangerous for your liver. Like I said, everything, including the medicines that you take, where it's a simple Crocin, a paracetamol, to something like whatever it is, a steroid or a heavy medication, it all goes through your liver. So the more you self-medicate yourself and you think that I'll take this because it's making me feel better, the more damage you are doing to your liver. Well, that's not just about allopathy, it's also about Ayurveda and natural supplements like nutraceuticals. If you do it the wrong way, it can damage your liver. We've seen so many people self-prescribe or overdo Ayurveda, overdo supplements. They just take liver supplements blindly because the label promises better liver health. It promises you to feel lighter. People overdo it on glutathione and supplements and all of that stuff. Anything in excess, even if it's good for you, is going to cause harm with your liver. So you want to be careful of that. Make sure you take supplements under professional supervision or professional prescription, because everything that's natural doesn't mean it has to be great for you. Exercise. Sedentary lifestyle, huge risk factor for liver disease. Huge risk factor. I used to be friends, I still am, with a surgeon in Brazil. He was a liver surgeon. And apparently Brazil has the most amount of liver surgeries that are done on a daily basis and in a year. That's because of heavy smoking, the abuse of drugs and alcohol and all of that stuff. And he was like, Luke, the thing is in Brazil, people are getting more sedentary and they're drinking more alcohol and smoking more. The worst combinations, more alcohol, more smoking, less activity. Exercise, if these people would even begin to do 30 minutes of exercise, it can reduce the risk factors of liver damage. That's for all of us. If we are sedentary, we decrease the amount of blood circulation. Blood circulation is important for every organ of the human body. So exercise is a huge risk factor if you are not doing it. Make sure you have at least 30 to 45 minutes or more of exercise in a day. Fad diets, again, I can't tell you the amount of patients we've had over the last couple of years who have gone to these fad diets, and then they come to us with kidney disease and liver disease because of the deficiency of nutrients, because the overconsumption of supplements, because they're not allowed to eat certain fruits and vegetables, so they're prescribed vitamins, and they overdo it on these vitamins, and that's a burden on the liver. So be careful of fad diets as well. We spoke about pollution, hydration, extremely important. Okay, water is a medium that is used by every one of your 37 to 40 trillion cells that you have in the human body. It is also used as a medium to flush out toxins. If you have dirt in the corner of your bathroom, you would flush it out with water towards the drain. The same thing in the human body. Water is important. Most people are dehydrated. Huge risk factor for every part of the human body. So make sure that your hydration levels are good until and unless your doctor puts you on a water restriction, sometimes in cases of a cirrhotic liver or post-liver surgery. You want to be careful of that. Your liver also has everything to do with allergies. So when people get allergies, the first thing is we pop all of our pills and stuff like that. When it comes to allergies, your gut plays a role and your liver. In fact, they call the liver the seat house of your allergies. If you have a strong liver, you may be able to overcome allergies that you suddenly get. Of course, some of us are born with particular allergies. We've had it through childhood, very difficult to get rid of. Not impossible, but difficult. But if you are that person and all of a sudden you start finding yourself prone to new allergies, okay, that's your body telling you that your liver is kind of weak or your gut is weak, or maybe both of them. So your liver, when you're treating allergies, when you're treating gut issues, you must take the liver into consideration in your recovery plan. Smoking, massive risk factor. We have so many smokers and tobacco chewers in our country, and they come to us with liver cancer and they say, no, it's not because of the smoking. I should have got mouth cancer, but it was because of the smoking. You don't understand a cancer can happen in any part of the body. We even have people with oral cancer who have never smoked a cigarette in their life. So the point is to understand that every time you smoke a cigarette, you are putting burden on your liver. Especially chain smoking makes it bad for your lungs, liver, every aspect of the human body. You have to remember that your blood carries oxygen to trillions of cells. Every time we smoke, we reduce that. Then cells are starved of oxygen and nutrients that are carried from your blood. So they begin to get weaker and weaker. When a cell gets weaker, there's a chance for the DNA to be corrupted. And that's when cells start to behave abnormally, which are examples of cancer cells. They don't respond to the immune system. They are able to disguise themselves from the immune system and form cancers and pathways to rob nutrition from your healthy cells and your healthy blood vessels. It's extremely important to understand things like smoking can confuse the intelligence of the human body, and it's a risk factor for your liver. Stress, absolutely yes. Stress can damage your liver in a huge, huge way. And again, that liver surgeon used to tell me, I said, well, why would people smoke so much? Saying because in Brazil, it's a below poverty level country. This was about 9 years ago. I don't know if that's changed now. And he would say that because people are stressed out, they smoke more. So it's a vicious cycle. You're stressed, so you smoke. And then you get sick because you smoke, and now you're stressed again because you don't have money to pay for your treatment. It's a vicious cycle. Stress damages every organ in the human body. It impacts every one of your trillion cells. You have to understand that. You may think and feel powerful because of your position, because of the money you may have, but you have to understand that your liver and your cells, they have nothing to do with all of that stuff. Okay, if you push it too much, it will give up on you. It will create disease. So you need to be careful of stress. While we're on stress, I want to talk about a particular emotion that is linked with the deterioration of the liver or liver diseases: anger. Anger, irritability, deeply rooted anger. These are emotions that we find in almost every patient who has a problem with their liver. You know, whether they have less bilirubin, too much of bilirubin levels, you know, higher SGOT, higher SGPT levels. Anger and emotional negative irritability is tied directly with the liver. There are several diseases that have an emotional connection. We know that for sure. So we know back problems are related to financial insecurity. You know, we know that IBS is related to anxiety and constant stress and thinking. We know a lot of cancers and weight gain is related to insecurity as an emotion. So it's not the only reason it causes your disease, but it plays a huge, huge role. And we've seen enough of people, angry people who have liver conditions. And as we start to work on them, they're taking their meds, they're doing their food, they're working out. As we try to work with their emotions, get them to calm down, learn how to relax, the enzymes start to change as well. So you need to understand the emotional connection of the mind and the body is real. You can't just take the liver and the heart and say, I'm only going to treat that. You've got to treat the mind. You've got to treat the emotions involved in that person's life as well. Extremely important. High triglycerides. Again, cholesterol as well. Cholesterol and the liver are directly connected. So when you put on a statin works with the mechanism of shutting down cholesterol production by the liver. The liver produces enough of cholesterol to maintain us. But when we have poor diets, inactivity, too much of junk, too much of sugar, we start to produce more cholesterol than the body needs, and that starts to jam up our arteries and our blood vessels. So you need to know that your liver produces cholesterol, which is a good thing. The problem is when you have something called triglycerides. Triglycerides are free fatty acids that roam around your bloodstream. It could cause a blockage in your artery that supplies blood to your heart, leading to a cardiac arrest, or it could block an artery that is supplying blood to the brain, causing a brain stroke, or to the lower body, creating paralysis. So it's extremely important for you to understand that you've got to control your triglycerides because it also affects the liver. So that's another risk factor. What are some of the tests that you can do? It's called a liver function test. So if you just go to your lab or you call in for a test, just say, I want to do my liver function test, they will give you the basics, which is your SGOT, your SGPT, alkaline phosphate, your albumin levels, and your bilirubin, sometimes your GGT, depends. They find something wrong, then they may ask you a couple of questions, or your doctor may order further investigations. Okay, I like to add CRP, which is C-reactive protein, inflammatory marker, along with the liver profile test, because that gives us a view of the total inflammation that may exist in the body, and then you can ask several questions to kind of narrow it down. High CRP is not always a bad thing. You may have just bumped your leg somewhere, it's swollen, and your CRP levels can go up. Whenever you get a blood test done or a parameter, never get worried. It has to be correlated with other symptoms, with other readings. So just don't look at one reading and say, oh no, something's going to be wrong with me. It's always correlated with something else. Okay. Now, what are some of the great foods that are good for our liver? There are no magic foods. Everything is good for our liver when it comes from nature. We eat it in the right quantities. Let me start with the stuff that's bad for your liver. Too much of white sugar, too much of processed food, junk food, products that have long lists in their ingredients and you can't even understand half of the words. All of your white flours, your white carbs, your processed carbs. Fructose, you overdo it on fruits. Some people have the habit of having 5 to 6 fruits at a time, thinking it'll make them healthier. You have a problem then of excess fructose in the body that can create issues with the liver. It can create issues with your blood sugar levels, and it can also create issues with your gut. It can cause inflammation in your gut. So nature gives you an apple, that's your serving, 1 apple at a time. It gives you a papaya, cut it down, share it with people, or put it in the fridge and have it the next day. Have portions of fruit. Do not do these fruit platters that have so much of fruit together. You want to have 3 fruits in a day, have 1 in the morning, 1 midday, 1 early afternoon, but spread it out. Never have too much of fruit at one time. Cruciferous vegetables finds its place in almost every condition. Every condition. Of course, if you have a thyroid condition, you can't do it raw. It's better that you steam it lightly, boil it, or cook it. But cruciferous vegetables like your radish, your kale, your broccoli, your cabbage, your cauliflower, your mustard, greens, all of these are super, super powerful for your liver. And you should be trying to get one of these cruciferous vegetables in your diet every single day. Black coffee is excellent for the liver. Excellent. It becomes a problem when you add sugar, your creamers, your frappuccinos, and all of that stuff. It's okay if you enjoy it once in a way, but have plain black coffee. It is excellent for your liver. Plain black tea is also excellent because of the high amount of antioxidants and the high amount of polyphenols in tea and in coffee. Fruits, you can't go wrong with fruits. All fruits, especially the berry family, whether it's strawberries, blueberries, raspberries, blackberries. The berry family is very powerful for the liver. All fruits are powerful for the liver again. Nuts, whether it's almonds, cashew nuts, whether they're hazelnuts, macadamia nuts, pumpkin seeds, sunflower seeds, all of the seed in the nut family is excellent for your liver again, unsalted, preferably unsalted. Fatty fish because of the omega. So omega-3 in small quantities. You can find it in fatty fish, you can find it in flax seeds, you can find it in walnuts, which covers nuts and seeds already. Great for your liver. One of the oils which have been scientifically documented to improve liver health is olive oil. For pure olive oil, extra virgin olive oil, it should never be mixed with refined oil. Never cook your Indian food in that because of the low smoking point. You can add olive oil raw to your salads. You can add it to your hummus. You can lightly do a saute of it, but olive oil is an excellent oil for the liver. But also pure ghee is, and so is coconut oil. So have a mix of all of your oils. Now, when it comes to exercise, all exercises are fine depending on how your liver is right now and how much of exercise you can take. But explore yoga. There are asanas for the liver. There are asanas for the thyroid gland, for the heart. Explore the asanas that are great for the liver and practice them. Your entire yoga practice should focus in an entire week on every organ of the human body and every part of the human body. That's what makes it a holistic yoga program for you. That brings us to deep breathing as well. Deep breathing, again, for every organ. If trillions of your cells need oxygen and every organ is made up of cells, it's a no-brainer that if we have a shortage of oxygen because we're not breathing the right way, we're stressed out, we don't know how to breathe, we breathe from our chest rather than from our belly, we're shortchanging the human body, including the liver. So even deep breathing pranayama is excellent for the liver like it is for every other organ of the human body. So it comes down again, the 4 verticals. Food. You saw simple, wholesome foods for your liver, hydration levels. Eat slowly, don't eat too much. Never eat too much of oil at one time, which is why deep fried food is a once in a way thing. If you have too much of fat, you have to produce more and more bile. Your gallbladder health and your liver are directly connected with each other. There's a problem in your liver, it can affect your gallbladder. Problem in the gallbladder, it can affect your liver. So looking after your gallbladder is also extremely, extremely important. So never burden your liver and your gallbladder by having too much of oil at one point. Have heavy fatty meals at one point. I know a lot of diets like keto and all of these stuff, they suggest high fat diets. I don't have a problem with it, but people need to do it the right way. And they need to understand that you can't live like that forever. Of course, you lose weight. And for the people who want to lose weight, keto diets will turn out to be the best for them. It's not sustainable. You need to understand that the human body requires balance. And there are so many other ways of losing weight. Before keto came up, there were still people losing weight using lifestyle changes. Understand that. Exercise, again, something as simple as yoga and a gentle walk is a good enough exercise program for anyone's liver to maintain and keep it healthy. Stress, we spoke about, whether you meditate, sit in silence, have a hobby, build nurturing relationships, do things that make you feel happy. That's how you reduce your stress. Everyone can have stress, and stress is only going to get more and more in people's lives. More stress that you foresee coming into your life, the more outlets you have to build to relax, to learn to relax. If I'm going to take on more and more projects, I'm also going to make sure that I make my body and my liver and my kidney and my brain and my heart stronger and stronger so I can take more stress. I can build myself for more stress. And we spoke about anger. Again, is a very negative emotion. It hurts us at every level. At a deep cellular level, it hurts our organs, the way we feel, and then it further creates emotional issues in our lives. So you want to learn how to tame your anger. And last but not least, your sleep. Everything gets better when you sleep. A damaged liver will heal itself. Kidneys, the heart, the vessels will relax. You can only get better. You can only repair. Your organs can get stronger and rejuvenate in a state of complete rest, which is sleep. So we don't have to complicate it. We don't have to do the milk thistles and all of that stuff unless we really need it. It's great. Milk thistle is great for the liver. So is celery. So is dandelion root. I have a cup of dandelion root every single day because I love the taste and I don't want the caffeine in it. And I just feel so good. So the point is, you can use all of these things, but if you're living a life of balance, what I told you is the simplest thing. And whether you go to a Mayo Clinic or you go to a Sloan's or whatever, and you ask any liver doctor, what should I do to look after my liver? They will give you the simplest possible answers, which is eat clean, stay away from junk, make sure you're active, sleep well, and look after your stress levels. And of course, if you have a liver condition, you can feel free to reach out to our team, and our team will try to guide you with the videos that we've already done or put you in the right direction. Thank you so much for your time. Look after your liver, and remember, you care. It starts with you. It's all about you.